All right, good morning, everyone. We are going to go ahead and call to order at 10:31. Just a couple items from the last meeting. Just a reminder, this meeting is being recorded, so everything said and shared in the meeting will become a part of the public recording that is shared on the website. A couple other items. People did have some audio issues during the last meeting. If you can please use a headset, that usually does improve the audio. And just a reminder that if you are off mute, so please keep yourself on mute unless you're actually speaking. I'm going to go ahead and turn it over to Shelley for a roll call. Shelley?
Thank you, Dr. Bradley. Alberto Goodyear. Brian Smith.
Present.
Chris Salvino. Dale Woolridge. Dylan. Dan Spate.
I'm here, Shelley.
Thank you. Deborah Garambe.
Present.
Edgar Bissonette.
Here.
Bronco Castermarin. Gail Bradley.
Present.
Darth Gamer.
Present.
Glenn Kasperzik.
Present.
Heather Miller.
Present.
Howard Reed.
Present.
Dr. Eve.
Present.
James Hayden.
Present.
Michelle Preston.
Present.
Mike Duran. Rebecca Harrow.
Present.
Rodney Reed.
Present.
Royals.
Riles, present.
Sarah Perotti.
Present.
Shari Brand. Sharon McDonough. Stevie Merrill.
Present.
Todd Hadamio.
Present.
Vince Martinez.
Present.
Vivian Gellert.
Present.
Yeah, we have quorum.
All right, thank you very much, Shelley. I'm going to do a quick audio check. For those online virtually, can you hear the audio okay?
I can.
Yes.
Excellent, thank you very much. And just a reminder, if you are having any issues with your audio, go ahead and try a headset. That should help a little bit. Attached in your packet is the attendance report. Just a reminder that if you missed 2 or more consecutive meetings, you will be contacted by the Bureau to determine if you still would like to participate on the board or council. Vacancy report, we do have 4 current vacancies, 3 public members and 1 for a hospital administrator for a county population greater than 500,000. We have had several reappointments, Dr. Spate, Glenn Kasperzik, Dr. Merrill, and Dr. Brand, so congratulations on your reappointments. We would like to welcome a new member, Trooper Edgar Bissonette, so welcome to our committee. Thank you very much. I briefly wanted to touch on the FR Care grant. This is a grant that the Bureau had previously and ended a few months ago to help support naloxone administration for law enforcement and EMT-only agencies. The Bureau had applied for that grant again moving forward. We were awarded that grant and it does go live October 1st. We did change the grant a little bit moving forward to allow us to focus more attention to naloxone leave behind. And we are also going to provide some more options for training and education. There is some FTE funding to give us the manpower to help support the program as well. So we are very excited about that moving forward. If you have any questions about naloxone leave behind in the packet for the agenda, you do see a link to our website. This includes an educational PowerPoint along with resources that you can use. So again, that is in your packet there as well. Just a couple reminders that this month is Suicide Prevention Awareness Month. If you click on the hyperlinks, there are a number of resources from ADHS to highlight this. We definitely realize as we reviewed our staff report that this is an ongoing issue and we want to highlight resources available to everyone within the state. In addition, if you see there's a 988 suicide and crisis line, as the 988 number went live in July, this is something that is still in the ramp-up mode nationally, but there will be more resources added to this portion of the website. In your packet, there is the draft agenda for 2023. Shelley did
It's final.
It's final, got it. Shelley did a great job of hopefully cross-referencing all major calendars. If for some reason we missed something and you see a major conflict, please let us know and we can look to adjust that, but hopefully we have captured any potential conflicts with that. Next up is the Bureau report. I will turn it over to Chief Garcia.
All right, thank you. I'm going to go slightly out of order right before we jump into the slides, and I'm going to introduce our newest Bureau team members. So, welcome. We're going to embarrass you 2 more times today, the second time. Welcome to Russ Lindholm and to Stephen Ferris, our 2 newest EMS regional coordinators. We appreciate you being with us here today. We won't make you speak unless you want to, but both of them come to us with a tremendous amount of EMS experience, and we are looking forward to them being resources in the community to all of you as EMS regional coordinators. Noreen, anything to add to that?
No, we're all excited to have them, and they've gotten off to a great start. Yeah, welcome to our team.
Yes, welcome. Thank you.
Thank you.
All right, then next I'll also just say we do have a scope of practice update that is published on our website when open for public comment. We want to make sure that this group in particular knows that the public comment period is open through this weekend. I believe it closes on Sunday. We will be reviewing the comments that we have received next week, and I believe we have about 20 submitted so far. So thank you. You all know that this update is based on the recommendations that we received from the Medical Direction Commission in alignment with national standards. Shelley, we can go ahead and jump into the slides now. I'm going out of order. So apologies to Shelley in advance. This might be just a few more clicks, but we'll go ahead and we'll go to our snapshot of our Arizona EMS system as one of the updates we wanted to share with you all today. I know the text here is small, but we wanted to let you know we are continue to capture a large amount of data, and we will be refreshing this information to reflect 2021 data in the near future. Our next slide is a quick snapshot of our Arizona trauma system snapshot. This one is displaying our 2020 page that we put out this past year, and we're happy to report that we have a 2021 trauma system snapshot that we will be displaying here shortly. Apologies, I thought that was the one.
All right, are we loaded?
We can go ahead and just keep rolling past this slide. Sorry, it might be like 5 clicks.
Just a reminder, I did put several people on mute. If you are not talking, if you can please keep your phone or device on mute. If you're on a telephone and need to unmute yourself to talk, you will need to use *6. So just a reminder that everyone was placed on mute. Thank you.
So a quick update on the Bureau of EMS and Trauma Systems here at the Department of Health Services. We wanted to make sure we were sharing with everyone that looking at this past year and this year, we have received a $3.8 million EMS fund appropriation that continues to support about 30 full-time employees here at the Bureau. We wanted to share a little bit of information about the work that this team continues to do here at the Department of Health Services. We all can see from the screen that there are over 20,000 registered EMCPs in our state currently. That includes just over 7,000 paramedics certified here in the state of Arizona. There are over 60 EMS training programs, including BLS and ALS programs. We have 47 designated trauma centers and 50 base hospitals. We have nearly 100 CON holders currently and 19 certified air ambulance providers. And our team continues to work with cardiac receiving and referrers. And we also, at the very bottom of this slide, wanted to highlight that as the naloxone Leave Behind program and our funding continues on the grant side, in this past year, we recorded over 12,000 naloxone doses administered and over 7,000 individuals that received those doses. We can go to the next slide. A few more clicks. Again, for this year, the Bureau did receive an EMS fund appropriation of $3.8 million. That's not always reflective of the cash balance that we have access to here in the state. The funding that we received under that appropriation is also going to fund 4 local EMS coordinating systems, our 4 regional councils that are represented on this call here today. Our original allocation that was shared with them this year was in the ballpark of $442,000 coming out of our appropriation, and we're glad to report that we've also identified additional funding for a total of $842,000 statewide that we'll be pushing out to those regional councils. The additional funding that we've identified is going to be put towards paramedic education, particularly rural paramedic education, and we're looking forward to discussing further with our regions as we get ready to distribute that funding. We'll also talk later in the agenda today about House Bill 2609, a CON bill, and some funding that was appropriated related to that recent bill. Real quickly, I wanted to give an update and share that we have monkeypox resources available on our website for both EMS and healthcare providers. The web URL is shared there, azhealth.gov/monkeypox. And I think that what to know is that you're not typically at risk in normal day-to-day activities. We can go ahead and advance through here. To prevent and protect yourself, both EMS and healthcare providers are recommended to wear masks and gloves, gowns or eye protections when working with high-risk individuals. And let's go ahead and go to the next slide. Coming soon, a couple announcements. We do have a new EMS portal that will be updating our ems.azdhs.gov website. You all know this as the portal that we all refer to for EMS certification on a biannual basis. We're happy to report that we will have a new system available by early 2023. I think the next slide we have here does share a quick snapshot of what that might look like. Here is an idea of the web page that will replace that website moving forward, and we look forward to sharing more updates as we move forward with that implementation process. Actually, I think that's the end of the Bureau updates for now, and I'll go ahead and defer to the next items on our agenda. Julia, do you want to take it from here with the system snapshot and or share program updates?
Yes, I can give the share update.
What is the going to request that you move closer to a green-lit tile for the microphone? While Julia is moving, I think a couple people have joined the meeting that are on the roster for purposes of capturing your attendance. If you are here and missed roll call, can you please speak up and let us know so we can capture your attendance? Anyone who missed roll call?
Yeah, this is Franco. I believe I missed roll call.
Thank you.
This is Dale Woolridge. I think I missed call too. Thank you.
This is Forrest Taylor.
This is Cynthia Wattier.
And this is, again, just for people who are on the EMS council. My apologies for not clarifying. Any EMS council members who missed roll call?
Shari Brand.
Thank you.
Dr. Bradley, I have a quick question, if you don't mind. Related to the applications that the Bureau is seeing, are we able to benchmark those from year to year to see if we are indeed attracting more applications into Arizona and under what level of certification?
With respect to EMCT?
Yeah.
With those applications, yes, this past EMS annual report, we did do a breakdown to see how we're doing year over year. The number of EMCTs has increased in Arizona when we looked at it for, I think it was like the last 5 years. It's not increasing at the rate we would like, and certainly not increasing at the rate we would like for paramedics. So anything we can do to support rural paramedic education, we'd love to make sure that we're pumping resources out into the community to build that pipeline.
And then a follow-up to that would be, are we able to look at that data and trend it to see where potentially we're receiving the applications from? For example, I'll just say certain times of year you may see the increase from eastern states where they have a lot of snow, right? They come here, whether they're snowbirds or they choose to move to a warmer climate. Are we able to benchmark and start looking at some of that potentially to see any kind of trends?
Yeah, I swear we did not plant these questions. I'm so glad you asked, because moving towards image trends and that new EMS portal we talked about will give us ability to begin looking at some demographics and metrics that we did not have the opportunity to look at previously. Our hope is that we will be able to get eyes on trends like that in the future. Anecdotally, we all know what that looks like throughout the year, and Maria, that you all know, could sit in here and tell you what that looks like throughout the year as folks come into the state. But we want to make sure we have data on it, and image trend is going to be that opportunity for us moving forward in 2023. So, thank you for your question.
And just to follow from the chat before we move on to Julia's report, a few follow-up items. There was some requests about how to become a member of EMS Council in the chat. Shelley did put the link to the Governor's Office of Boards and Commission if you would like to apply for a position on EMS Council. Again, this is a governor-appointed position, so there is a link in the chat on that. Dr. Gamer, again, echoed what he said at Sept. Welcome Russ, and Stacy will miss him. So another welcome to Russ at the Bureau. And then there were a few requests to see if the PowerPoint that was just shared could be shared with members of the committee.
And the answer to that is yes. The rest of the PowerPoint includes legislative and rule updates that we'll share towards the end of this agenda, and absolutely these slides are shareable.
Thank you very much. All right, we will move back to Julia now for a share update.
Okay. So just a quick update. So we currently have 34 recognized receiving centers and 2 referral centers. There is an updated list posted on the website for your reference. For participating hospitals, hospital and SEMI reports are currently available for download on Cedar, and missing lists will be going out to hospitals by the end of this month. We just encourage you to keep getting outcome data in. EMS reports are in final review stage and should be distributed soon. And then based on share data, we've had a 7.6% increase in out-of-hospital cardiac arrest last year of 2020 to 6,829 cases, the effects of the pandemic, along with increased capture of data statewide. That's all I have.
All right, thank you very much, Julia. All right, and then what we do have displayed here is the Arizona Trauma System snapshot. For those of you that were not on the staff meeting, we did have a very thorough report of the snapshot. In addition to the entire staff report that was approved by staff. A few highlights just to point out here, we have at the top our trauma incidents, the total number reported to the Arizona State Trauma Registry. I think a point of clarification of where some questions came up at the last meeting. When you look at the difference between number of injury-related discharges, so injury-related discharges is any patient that goes to any hospital within the state of Arizona, so it is all hospitals and all facilities. When you look at the number, which is 65,000, that number is specific to patients who are transported to a trauma center of any level, so 1, 3, or 4. So when we look at our trauma data, which is specifically demonstrated in the snapshot as well as the staff report, that is specific to patients that are transported to trauma centers. You'll see the mortality levels by mechanism of injury and see that falls are definitely one of the top ones, followed by firearms. One of the issues we did add this time to control a little bit further down is top mechanisms of injury, those adults as well as pediatrics, defined as 0 to 17. One of the things that was brought up at staff was the question about child abuse and what was the reason for that number being relatively low. And again, that was just a reminder that the numbers that get into this report are specifically patients who are transported to a trauma center. We know, unfortunately, many of these patients may have injuries and are transported to non-trauma centers and would not be captured in this report. To scroll down a little bit further, risk and protective devices and opportunities for injury prevention. We did have good discussion regarding this. If you look at occupants wearing a passenger restraint or seatbelt, we see just under 69%. So this number is pretty stable. We definitely see a low number with that. We also see passengers that were more likely to die in a car accident if not wearing a seatbelt. Makes sense, obviously, if you're not properly restrained. One of the points of discussion that did come up was about motorcycle helmets. Has legislation been pushed in the past? We did have discussion that has been pushed forward but did not make it through the process previously. And also some discussion regarding off-road vehicles where that seems to have the lowest use of any type of protective devices, including young pediatric patients. And so really some opportunities for injury prevention. So wonderful snapshot that was put together. A big thank you to Vossel for all the data for the staff report and to Julia for putting together the snapshot. So thank you both. Any questions regarding this part? All right. Next, NEMSIS 3.5 update. Ann?
Sorry, I couldn't get to unmute. Hi, everybody. So as most of you hopefully all have heard several times, we are transitioning to version 3.5 of the AZ-PEERS database, which means all the EPCR products will need to switch over to 3.5 to continue to send us data. It'll be a bit of a long process. We're hoping to have everybody on board by July 1st, 2023. And we're still hopefully on target for that. Right now, I just had an EMSREG meeting about a month ago, and we went over a lot of the new updates and resources. So if you're interested in that, we have that posted on our public-facing website on the AZ-PEERS page. In addition to that, we have a new tab available on that page that specifically lists information for V3.5 transition and resources. And this includes things like EMS agency-focused transition checklist that may be helpful for agencies as they try to transition for things they might want to think about. It covers a lot because every agency is a little bit different, their vendor's different, that sort of thing. There's the data set, obviously, that's available, a summary of the data set, including changes, crosswalks, technical details in different formats, just to hopefully give everybody what they need for everything from their IT department to whatever internal group is going to decide what additional things your agency wants to collect. There's also some really handy flowcharts that I suggest everybody try to check out when they get a moment. We borrowed them from NEMSIS. I did give them credit. They're amazing, and they are basically different situations of documentation leading exactly how you would document them with the new dispositions. And I've gotten great feedback on how helpful they are, and I know NEMSIS is putting together additional ones, which we will link. And as far as where we are in the process, we are nearing completion of our first draft of validation rules for 3.5, being ready to test and review. The EMS REM form template is nearing draft completion, and kind of related to that, I really want to thank the EMS agencies and personnel who've assisted by asking questions, helping create some of these shared resources, and giving feedback. I think it's going to be a really great template and resources and set of rules I hope we start out with, but it would not have been without the EMS community's help. I'm working really closely with our state vendor. So as long as our vendor stays on track for updates, they have to create our state schematron, and we have to go through a NEMSIS onboarding process. Our current estimated go live date would be mid-October, but it may be earlier as far as accepting data. Just to be clear, no one will have to switch over to 3.5 at that time, but it should be available to start sending. I completely understand if people want to wait a few months and not be the early adopters, but if you are planning on some kind of schedule for transition, we are planning on having it available by then. And I'm looking to start beta testing with certain agencies in a demo format next week or the last week of September. Watch for emails and posts, that new tab we have, because that's where I'm going to kind of try to centrally put everything. And one last thing, I apologize for anybody who's been emailing me and that I'm behind on replies for other requests, because I've really been trying to focus on getting this pushed out, but I will get back to you. Thank you.
Thank you, Ann. And just a reminder, it's been several years since we have had an update from NEMSIS regarding data reporting. We know we have more agencies on board with this, so please be sure to use the resources that are on our website to help transition. Your vendor for your EPCR system should be very well aware of this. This update has been in the works for a few years now, so everyone should be aware and planning for this, but just want to make sure that we remind you, work with your vendor if you have any questions or concerns. Ann is definitely the person to go to, and really expert in this nationally. People from other states often go to her for resources. So important update with that. Next, we will go to National Registry update. TJ?
Good morning. I'm going to jump around on the report that I created a little bit because it'll help things flow a little better, I believe. For those who don't know, the 22 Res 13 by National Registry to expand eligibility, or most people know it as a state option, was officially rescinded on August 17th and generated a great deal of discussion. They got over 1,000 different messages from officials and individuals objecting to the plan that had been brought forward through that resolution. There's been a number of task forces developed out of the communication surrounding that. One of them is 2 10-member boards from NSEMSO that are helping to improve quality communication and collaboration on topics of this nature. So that one's officially gone for anyone that was not aware. They've also started some additional work on the BLS practice analysis that's going along with the BLS redesign. Hopefully everyone remembers the ALS redesign began in 2019, had an official resolution in 20, which was ironically enough, the 20 resolution 09, where they started to adapt some of the concepts with testing. The process has been going a little bit slower. I think the issues that we just had with the accreditation discussion slowed that down a little bit. So there are some items that are going to start appearing in late 22, early 23, but it probably will not be officially in practice until probably mid 24. The BLS practice analysis is going on. There's going to be a random sample of 18,000 EMTs and EMRs to help determine some of the knowledge, skills, and abilities to be successful in the daily work. That's going to be part of the BLS official redesign that's going on over the next couple of years. One of the other items that was an issue of discussion for quite some time was the permanent removal of distributive education limits. That goes into effect officially on September 30th of this year, but it's basically been in effect for the last couple of years. And this one's going to apply to all requirements for continuing education, whether that be recertification, state license, and re-entry eligibility, and the refresher training that's required after 3 failed exams to get more attempts. So all facets of the recertification or the distributive education items can be done basically remotely. In-person training is still recommended and will be accepted. One of the other items going on that's been a little bit of a controversy for some states is the required components of proof of education that's associated with policy number 51.49 of National Registry. That's still in the public comment phase. It's going to be voted on by the board at their November meeting, but that one won't affect us much here. We don't have a great deal of regulatory actions and activities within Arizona. We have training manager and medical director approval for those items, and basically what this policy does is it's the one associated with certification cards no longer being considered adequate proof of education for some of the required elements because of the ease in forging those documents. At the most recent state directors meeting we had the same discussion about certifications and certificates, and they were equally easy forgeries to develop. So one of the ongoing task force items now from that discussion is the linking of continuing education to the national EMS ID that everyone who's got a National Registry account has, and they grandfathered in roughly 2 million providers to provide them with that. So it's a standard ID that can be used much like the FEMA student ID, and we're hoping that will also be something we can use to automatically upload information into state databases like our transition into image trend in the near future. The other item that's going on with the workforce development that we've talked about with a number of different projects going on with National Registry and the SEMSO is trying to increase the number of folks, especially in the rural areas. We're looking at getting some of those folks who have lost their certification basically just to expiration, not through any kind of discipline process or anything like that, but those folks who have allowed their certifications to lapse and have a desire to get it back. There is a process that we've got outlined now to allow them to get back with some continuing education and some retesting of National Registry at all levels. And if you have anybody or know of anybody that's going to be interested in that program, I've got an email address that I'm using that I can send them some information on. It is emseducation@azdhs.gov. So anyone that you know that might be in law enforcement or in some other role that may have allowed their cert to lapse that's interested in getting it back, please have them send me an email and I'll get information out to them on reobtaining their certification at whatever level they held. Even if they never held National Registry certification, they're allowed to follow this pathway to obtain it and then get Arizona certification as well. And that's all I've got.
All right, thank you very much, TJ. Next on the agenda, refresher training for law enforcement on naloxone use has been updated. This was a question we had received as the original FR-CARE grant had sunsetted. Some agencies had requested additional training. If you go to the Bureau's main website, you go to naloxone and you go to the naloxone tab, there's online training module for law enforcement and EMTs. This module is done through a platform called Articulate. So essentially anyone who would like to do this training, they can click on that link, do the training, they answer some questions throughout the course, and they get a completion certificate at the end. So for any law enforcement agencies that are using naloxone or looking for additional training, it is very well put together. I did go through the whole training, and if anyone else is interested, it's an option for you. So again, our main Bureau webpage, go to naloxone. Under the naloxone leave behind section, there's online training for naloxone for law enforcement and EMTs. All right, next up, Noreen.
In the federal government, in an effort to prevent rural hospitals from closing, has created a rural emergency hospital category. With that, it's critical access hospitals that have 50 beds or less can apply for this rural emergency hospital category, and with that, they have to their length of stay in their hospital has to be less than 24 hours. So, with my association with the the SEMSO Trauma Managers Association, rural states are very concerned about this and how it's going to be impacting EMS and with the EMS's ability to transfer these patients out. So one of the, aside from that, they have to have a transfer agreement with a level 1 and level 2 trauma centers. If they seek this category, they will get an additional 5% reimbursement from CMS. So that's why the concern. We're not hearing a lot about this with Arizona, yet it goes into effect in 2023, that they'll have to start writing rules about this. I have very limited information. I just want to put that out there that we should, really think about this, put it on our radar. Like I said, it could have an impact, right now we know for sure that there are 16 critical access hospitals with 1 application pending critical access hospital. So it could have a significant impact on the EMS system and transporting patients out.
Definitely keep an eye on that.
Thank you, Noreen. Rebecca?
I had a quick question for Noreen. Is the list of hospitals that have this designated status posted on the Bureau's website?
No, it's not on our website. We don't have a lot of information on this yet, Rebecca. And, as you know, critical access hospitals are hospitals that have less than 50 beds. And so what they're asking them, and we have, like I said, we have 16 of them, and we all know who they are. I don't know all of them, but I know, for example, Banner Page is one. I believe Cobra Valley, Northern Cochise and Wilcox, Benson is one. There are quite a few, and there are quite a few that are level 1 trauma centers, level 4 trauma centers, though we don't think it's going to impact their trauma designation, because this won't affect that. What we do see is maybe an EMS impact, because what it is they're going to be trying to get these patients transferred quicker in order to maintain this status. So, as far as the state of Arizona is concerned, I'm not hearing anything about this. I've contacted our Office of Rural Health Flex Grant Program, asked them if they know of any hospitals for sure that are seeking this designation or this criteria, and so far they said they're not aware of any, but the rules don't go into effect. The state is going to have to start writing rules in 2023, and it's already been approved on the federal level. So, Todd, have you heard anything about this from?
I don't really know, so I'm sure we'll research on our end and see what we can figure out as well.
Yeah, I mean, I'm just seeing bits and pieces of this, but I know that the NASEMSO trauma managers in very rural states are very concerned about this.
Noreen, thank you. That was informative. I appreciate it.
You're very welcome.
Thank you. One more item just wanted to mention before we go to our standing committee and regional council report. Just a reminder about the importance of PPE for our EMS providers. We still do have COVID in the community. They anticipate that this may be a bad flu season. We have other emerging diseases like monkeypox, measles in Maricopa County. So just a reminder to help protect our EMS providers and their workforce families. Masking is really helpful for them when they're providing patient care. And just emphasizing that as we move forward into this upcoming season. Next, we'll move to standing committee and regional council reports. Rebecca, for TEPI report, please.
Good morning, council and guests. TEPI met July 21st. We did have a quorum for middle of summer. That's great. We did welcome 3 new members, and we also have vacancies on our committee. We are looking for a ground ambulance or first responder premier EMS agency QI officer. This would be for SAMES or Ames regions. We also have a state designated level 4 trauma center program manager opening. And then we also have a pre-hospital EMS coordinator for SAMES. That is an opening on TEPI as well. So if you know people that are qualified and might be interested, tell them it's a great group, it's user friendly, and we don't bite, and we would love to have them join us. We had our standard bureau reports from Chief Garcia, as well as identifying the new bureau staff and promotions at that time. And by the way, congratulations, Noreen, on your promotion. Well deserved, girl. Just again, a friendly reminder that the NEMSIS 3.5 update, we must have our agencies on board with this by July of 2023. So we're at less than 10 months and counting now. Hopefully everybody's set to go. And of course, we had our usual updates. Oh, great. Shelley posted an update. The TEPI QI officer role has been filled. For the update from trauma registry users, I think the most thing that concerned me was the fact that ESO is finalizing the contract to change to AIS 15, and they're getting the linking issues resolved, so that's helpful. Trauma program managers working on a new meeting schedule, and then of course our EMS registry users group busy helping all of our agencies get ready for the change to NEMSIS version 3.5. There were some discussion and action items, including fall data about ground level falls with hip fractures. Let's see, we also discussed the trauma snapshot. We added the top 6 mechanisms of injury for pediatric patients defined as 0 to 17 years of age. And then we also reassured attendees that the annual report and snapshots, they're always considering 0 to 17 for pediatric data, unless it gets broken down somewhere else. Dr. Bradley gave background on patient transport trends over time. We do note that patient refusal data is being collected, but discussion on this topic basically ended with no further action at this time. Same thing occurred with trauma scene times definitions. There was some good dialogue about it, but right now there's been no further action taken on this topic either. That's pretty much it. Our next meeting will be November 17th at 9 o'clock. And thank you. Any questions?
Thank you, Rebecca.
You're welcome, Shelley.
All right, next, Brian, for Education Committee update.
Good morning. Education Committee also met on July 21st. We welcome Dr. Jason Johnson as a new member. Some items that we looked at for that meeting was to form a work group to create educational materials for the new ACS field triage guideline updates. That work group was approved. We did, in fact, meet last week. And I think we've come up with a package that will be moving forward to Education Committee in November. As a result of a number of changes in the supplemental training requirements for the scope of practice model that was recently updated, a work group was formed to look at STR training for EMT airway skills, supraglottic, and CPAP. As a part of our 2-year review, I believe this was on the discussion, was to look at the educational materials for life vest resources. There were no suggested changes to that, and it was approved to go ahead and continue forward as it currently is. There were some resources for Stop the Bleed program that were approved to go to the resources for that, and that was the compressing the zones of care. We also approved a work group to look at developing educational materials for training on death notification for EMS. We are currently on all of our training on the Bureau's website. We've been on a 2-year revision process, and a motion was made to change that to a 3-year cycle in the future, and that motion was approved. There was discussion about thrombolytic use in EMS. There was a query made on AZ peers for 2021 and 2022, and it was presented that there had been no paramedic administration of thrombolytics in the pre-hospital setting for air or ground. That was also, since that is an STR in the scope of practice, that was done to look at whether we really needed to develop an STR curriculum, and there was no motion made to do so. Our next meeting is November 17th at 10:30. And that's the end of that report.
Thank you, Brian. You're up next for PMD report.
All right. PMD also met on July 21st. We welcomed Mark Hansen, paramedic, and Philip Hannum, ND, to the committee. A significant portion of the work that we did is to update the Arizona Triage Treatment Transport Guidelines to see what we want to do about matching them up with the national guidelines, national clinical model guidelines. And so there were a number of those that we looked at, and many of those will be going forward to Medical Direction Commission today. There was an agenda item to discuss medical direction for hospital-based paramedic practice that was tabled. There was also an item to look at making diltiazem required instead of an optional drug on table 1, and that was tabled for now. And that is the conclusion of that report. Our next meeting will also be on November 17th at 1200. We also had actually have one more. We did have a special meeting of PMD that occurred on August 30th. That was to continue looking at the triage treatment and transport guidelines. We did look at a number of amendments, changes, revisions, and updates, and some of those will be moving forward to Medical Direction Commission today also. And that completes the end of that.
All right, thank you very much, Brian. Next, we'll go to regional council reports. We'll start with Ames. Roy?
Thank you. I believe you got as attachment VD1, the Central Region report. I'll just briefly highlight a couple of things. We had our 22nd annual EMS Odyssey conference. It was a Zoom conference, some tremendous speakers and great participation. We had 175 participants that registered, and of that, 109 CE certificates were issued, 85 for EMTCs and 24 RNs. The 23rd EMS Odyssey Conference will be held on June 8, 2023, and it is also scheduled to be a Zoom conference as well, so put that on your calendar. The last area I'd like to highlight is, as a result of some of the concern from our rural providers about not being timely informed of the changes in the triage and treatment guidelines, AIMS held a rural EMS summit, which was extremely well attended from our rural providers, and we came up with an action plan for the Central Region for AIMS to establish a rural sector. So there will be reporting and direct communication to the rural sector in each of our meetings, encourage more involvement from the stakeholders, assure that the organizational processes are followed related to guidance action items to make sure that our rural providers that may have less opportunity to be informed of what's going on in the state of Maricopa better understand what the changes are proposed and are timely informed. And last, we have officially requested that the Valley Medical Directors change their name to the Central Region Medical Directors, as their guidelines apply pretty much statewide now. So wanted to highlight those, and that concludes my report, and everything else is in the written report.
All right, thank you, Roy. Next up, Sarah, for SAMES report.
Good morning. Thank you, Dr. Bradley. With respect to material updates for this group, we actually are just prior to our next quarterly regional council meeting, as well as our upcoming medical directors and regional trauma. Those are our three largest groups. And so we are, like I said, we're just in advance of those meetings. So nothing to report on those yet. However, in the upcoming, both upcoming meetings, we'll have some pertinent updates to report in the next review. Our October meeting is the final of this calendar year, and we will do the final updates to sunset the SEAMS protocols and standing orders to the state T3Gs. So we're looking forward to that. We suspect that will happen in January as planned. I don't have any other updates unless someone has questions for me. Thank you.
Thank you, Sarah. Next up, Vince, for our names report.
Good morning. I have submitted the names report if you'd like to read the details of our August meeting. But some of the highlights, names, we are working to deliver another awesome pediatric symposium on March 6th and 7th in Flagstaff. Looking forward to your participation. We also voted in Troy Hoke, he's a battalion chief at Cottonwood Fire Department, as our names representative for the State Education Committee. We also voted in Jeanette Hovey from Native Air as our consumer board member, and Dave Manning from Coconino Community College as an education board member. Our next meeting will be November 4th. Thank you very much.
Thank you, Vince. Next, Rod, for Watkins report.
Good morning. At our last meeting, well, at our meeting on May 12th in Lake Havasu City, we held our annual elections, and we actually had a change for this year. Forrest Taylor was elected as the WACM's president, and the balance, the vice president, secretary, and treasurer all remain the same. Forrest is a division chief with Bullhead City Fire, and we really look forward to having him on the executive board of WACM's. Provider assistance timeline was approved at our July meeting in Pine Lake. and the applications have been distributed. Also, we are going to be simulcasting this year's Arizona Trauma Association STACS conference again for, I don't know how many years we've been doing this, but we simulcast it or pay to have it simulcast at the base hospitals in our region. And we are looking forward to getting our contract finalized by the state procurement office so we can get these spinning wheels on the ground and get some traction. And that's all I have.
All right, thank you, Rod. Next up for PACES report, Dr. Woolwich, would you like to do that? Or would you like Adam to cover that for you?
No, I'd like to if I could. Thank you so much. And hello, everybody. This is Dale Woolridge, Chair of the Pediatric Advisory Committee for EMS. We had our last meeting on July 21st. And at that meeting, we were able to appoint a new committee member. And that was Ray Proa, currently practicing paramedic. We look forward to working with Mr. Proa in future meetings with the advisory committee. We had discussed in that last meeting also some regional contract updates to our EMS regions. Adam Rodriguez, also being the EMS state partnership coordinator, had updated this to be inclusive of a pediatric emergency care coordinator for each region, and he is working closely with each region to identify that pediatric champion for each of the EMS regions. The PACES committee continues to develop work groups to identify educational gaps in relation to pediatric care. In our last meeting, we discussed topics related to children with special health care needs and of children and pediatric abuse, neglect related health care. And those are in development as we speak. And we also are looking to fill another position. If anyone might so be interested, we're looking to fill a vice chair position, a volunteer position for PACES that would be essentially working alongside myself as the chair of that committee. Our next meeting is November 17th, and we look forward to everybody being there. And Adam, I didn't want to steal all your thunder. You might want to mention about some of the grant opportunities you're working on currently.
Yes, just to add on to that, we are actively engaged in our grant writing process, and good news is that we have an increased ceiling for that grant limit. So that will go to serve better pediatric training within the state. Thanks, Doctor.
Okay, thanks everybody.
All right, thank you very much. Next for discussion and action items, first up is discuss, amend, and approve the EMS meeting minutes from May 19th. If I can get a motion in a second, if you're on here virtually, if you could please say your name, please.
Rebecca Haro, motions to approve.
Thank you, Rebecca.
Second.
Gamer,
Sorry, Brent,
second.
second.
I didn't catch that.
I heard Dr. Gamer second, I believe.
Okay.
All right, we'll scroll through these. These are in your meeting packet as well. Are there any recommended amendments to the meeting minutes? Hearing none, anyone opposed to the meeting minutes as displayed and shared, please say nay. Hearing none, any abstentions? All those in favor, please say aye or type yes in the chat box.
Aye.
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 All right, thank you. Meeting minutes are approved. Next, discuss legislative and rules updates. Chief Garcia.
Thank you. Shelley, can I ask you to hit refresh real quick before we go through? I apologize. Yeah. Google's giving us challenges today. And for the members in the room, I broke both of the printers, so that's why you don't have a paper packet. Right, you can go 2 more. So really quickly, we will run through some EMS legislative and rule updates.
The first slide we'll share is a brief summary that I think captures some of the high notes. This slide deck can be shared after this meeting, and it does include more in-depth legislative updates, both state and federal. We may not have time to get through all of it, but we want to share it with you. Some of the high notes from this past legislative session, it was a busy one. House Bill 2431 is an EMS bill that affects transport, effective September 24th of this month. House Bill 2407 is a mileage rate calculation bill that codifies rule requirements previously into statute now, again, effective September 24th. We've also had some recent discussion on Senate Bill 1210, which covers court-ordered treatment and allowing authorized transporters to contract with the city, town, or county to provide interfacility transport for behavioral health patients. That one is also general effective date, September 24th. And then House Bill 2609, a CON bill, requires the Bureau to gather additional resources to build capacity to implement these new ambulance service requirements. That is that is not a general effective date. That is delayed implementation until January of 2024. We have a few rule updates highlighted here. There were new air ambulance rules implemented in June of this year. As we mentioned previously, EMS scope of practice, a draft is currently posted for public comment through this weekend. And finally, I think most of the folks in this room know that the department continues to review ground ambulance rulemaking with stakeholders. We have a work group assembled that will likely reconvene in October, and we are beginning to look at House Bill 2609 requirements to determine the path forward on rulemaking for ground ambulance. These next slides, I won't go through all in detail. The format is that we will, when we share these, provide a link to the bill, a link to the detailed summary, as well as the effective date. This is the mileage rate calculation bill, which is fairly straightforward. Again, moving what is in rule into statute with one exception, and that is considering what the department can consider when calculating mileage rates for ambulances. The exception is mileage rates as defined by CMS. Next slide. House Bill 2374 refers to the Acute Care Pilot Program bill. And under this pilot program, services for mobile paramedics for home patient assessments. It outlines requirements for a mobile paramedic, scope of practice, and supervising physician under this limited CMS pilot program. Next slide. Senate Bill 1210, I think we've had some discussions about. It does begin to define an authorized transporter and provides an option for, again, contracting with city, town, or county for a CON provider to provide interfacility transport. It also establishes a study committee on alternative behavioral health transportation, and that committee will be developing training criteria and recommendations for authorized transporters moving forward. Next slide. Senate Bill 1311, this does talk about aggravated assault and a knowing assault of a healthcare worker being considered a Class 6 felony. This does extend to EMCPs and firefighters. It also requires that by July of 2023, all hospitals, freestanding EDs, and urgent cares with more than 50 employees implement a violence prevention plan, and that is a workplace violence prevention plan. There are other requirements outlined within this bill, but again, when we share this, there is a detailed summary that can be found through the hyperlink here. Next slide. There were a couple different healthcare workforce grant bills that did pass this session. One outlined here establishes funds for nursing education, a preceptor grant program, and a pilot program fund. The first two bullets that you see here are grants that I understand are being made available directly to education organizations, universities, colleges, and institutions that provide nursing education. They will directly be able to access these funds. The preceptor grant program for graduate students, I understand, is similar. There are no RFPs related to these programs. Whereas the pilot program fund, that one will be administered by ACCESS, and I have a little bit less information about that, but these hyperlinks can provide a little bit more if anybody is interested. We skipped over, there was another bill, and it's not your fault, it's Google. There was another bill related to healthcare workforce, which allows the Department of Health Services to actually put out an RFP for accelerated nursing programs. We should have more information by the end of this month or early October. There will be an RFP. There was around $44 million appropriated for accelerated nursing programs, and that is specifically for accelerated nursing program scholarships for students that will participate in 12 to 18-month programs, aimed at increasing the RN workforce, of course. Next slide. I think that quite a few folks on the line are familiar with Proposition 310 fire district funding. This one proposes an additional 0.1% tax that could go towards fire districts to be used to improve 911 response time. I know there's additional information out there on this particular proposition. We've hyperlinked some information here, and it will be on the ballot and would become effective if approved by voters in November. Next slide. House Bill 2431. This one requires EMCTs to comply with EMS standards and protocols established by local medical direction or regional councils when considering emergency transport. This bill prohibits an EMCT from providing a patient with a presumptive medical diagnosis and using that medical diagnosis as a basis for counseling the patient to decline EMS transportation. The "and" is important there because it's saying that you cannot provide the presumptive diagnosis and use that to counsel a patient out of receiving transport. Number two, an EMCT is also prohibited under this bill from counseling a patient to decline EMS transport except as part of a specific alternate destination or treat or refer program that includes quality management and comprehensive medical direction oversight. The bill goes on to assert that it is not a violation for an EMCT to inform a patient of the patient's right to accept or decline transportation, unless the EMCT does so in an effort to coerce the patient to decline services. We have a more detailed summary linked here, and I'm not sure if there are specific questions related to any of these bills. We can certainly pause at the end if there are any specific questions. One of the items that we have noted, particularly in our discussions with regional councils, is because this bill does refer to EMCTs complying with standards established by either their local medical direction or regional council. We've had discussions with all of the regions to ensure that these types of protocols are being looked at and updated to be in compliance with House Bill 2431. Next slide. Is there a comment on the line? All right, we will keep moving through House Bill 2609. It notes at the top that this bill is not effective until January 1st of 2024, but a few bullets to note about this bill in the meantime is that by 2024, this bill would require that all ambulance services install a GPS monitoring device at each vehicle that is used for transport, specifically to record on-scene arrival time. Annual response time reporting must be submitted to the department and made available publicly, and that would be on an annual basis. Response times would be required to be reviewed by the department every 6 years. and temporary authority to operate an ambulance may be issued to a CON holder or fire department, district, or authority for up to 180 days at a time if specific criteria are met. We have a couple more bullets on the next two slides about this bill since it is very lengthy. It would change the initial or amendment application process in multiple ways. In the interest of time, I don't know if I can actually make it through all of these slides, but I will tell you that we look forward to having more discussion on this bill that again would impact the way that initial CON applications and amended CON applications are processed. And we'll go ahead and I think go to the next slide that are federal updates, and certainly we can come back to talking about some of the bills that we were not able to cover in detail. This slide shares a little bit of information about the No Surprises Billing Act and the CMS Rural Emergency Hospital proposed rulemaking that I believe we discussed earlier in the agenda. The No Surprises Billing Act, everyone knows, went into effect January 1st and requires good faith estimates and patient-provider payment dispute resolution. It is currently only applicable to air ambulance services. It does not apply to ground ambulance services. I think that is something to note. We have heard from the community nationally and locally that there are concerns about this being applicable to ground ambulance services in the future, but currently it is only applicable to air. We've also heard from the community there have been indirect impacts to our trauma centers who have had providers that are receiving decreased compensation or reimbursement as a result of the No Surprises Billing Act. I won't go into detail on the CMS Rural Emergency Hospital proposed rulemaking other than to say that we do not yet know the impact to ambulance services or EMS transport. This is something that we intend to keep an eye on and share more information as we learn more. Google has not refreshed the way we expected today. When we do distribute these slides, there's a third bullet point related to another notice of rulemaking that we received yesterday, and that is related to federal highway safety funding and how that funding may be used for states in the future and how that funding may potentially impact our responses and our trauma centers in a state like Arizona. We will keep everyone updated as we learn more, but that rulemaking will be open for public comment as we understand it. And many of our national organizations like NSEMSO will be providing us with updates on those sorts of things. All right, let's see, next slide, I think is just an overview of some of the rulemaking we will be doing in response to what we have discussed with this busy legislative session that just wrapped up. You all know from our conversations throughout today that we just completed some rulemaking and the EMS scope of practice draft is online and ready for public comment. We'll look forward to continuing to meet with stakeholders to review House Bill 2609 and determine what additional ground ambulance rulemaking is needed as we move forward. I think the most important information on this particular slide is the link to our ADHS website, where all of our rulemakings are posted and available for public comment, of course. Definitely welcome any questions, but I know in the interest of time, we only have about 15 minutes remaining.
Dr. Gamer has a hand raised. Go ahead, Dr. Gamer.
Chief Garcia, I'll be as brief as I possibly can be here. I've done a lot of education and had a lot of one-on-one discussions with field practitioners, and it seems to me there's a couple of overwhelming questions that I really can't answer or foresee the results of right now. It seems like what's probably going to happen is there's going to be more online medical direction activity, which you know, there's a couple of methods of providing online medical direction, the base hospital method and from central medical direction operations centers. And so I would have our base hospitals keep track of how many more calls for direction they get and how that might impact their emergency department services. And another question that maybe you can give me a insight to is there going to be rulemaking around House Bill 2431 regarding enforcement actions? Any complaints that comes to ADHS or the Bureau under that new statute? Thank you.
Dr. Gamer, thank you for your question. Related to House Bill 2431, that bill did not specifically outline any rulemaking. And so at this time, we are doing a review to determine if any future rulemaking is necessary, but that bill did not require any additional rulemaking, so we don't have anything open. And I guess just commenting on your other remark regarding increased volume, either it's calls to online medical direction and or increased volume to emergency departments. Following this agenda item, we'd hope to have a conversation about the EMS and hospital collaborative patient offload plan, which we hope can be used as a tool to be able to facilitate and streamline potential increased volume to our hospitals.
Thank you.
Any further questions or comments before we move to the next agenda item?
Yeah, hi, this is Daniel Sept. I'm medical director for AMR. I just wanted to get the pros perspective on some of the language in the bill, House Bill 2431. It seems like there's some debate over the language in that it can be interpreted to mean that all refusals require a online medical direction, and the option is either the administrative medical director or the online-based hospital. Or the other option to interpretation is that you do not have to patch on all of them so long as your protocols allow for you to take offline refusals, so to speak. Just interested in the Bureau's perspective on that.
Doctor, thank you for your question. I would refer to under 362219A, which again will go into effect September 24th. It talks about following your local protocols and or regional protocols. Verbatim, it talks about an emergency medical care technician shall contact the physician who is providing administrative medical direction or a physician in the base hospital's emergency department consistent with local protocols and practice guidelines if emergency medical services transportation is not provided to a patient. We really look at this as long as an EMCT is following their protocols per their medical direction and or their regional medical direction protocols, that is in compliance with House Bill 2431, which will be A.R.S. 362219, effective September 24th. Does that answer your question?
That does, thank you.
Any further questions or comments? All right, thank you for that summary. Next, we will go to discuss EMS and hospital collaborative forum.
And I'll tag in here and just really quickly, I want to thank several folks that are in the room and on the line that have participated in some EMS hospital collaborative meetings. There have been several in the central region most recently, and this week we did convene also a statewide group, including representation from each region, to also discuss EMS hospital collaboration moving forward. This EMS hospital collaborative patient offload plan we think is particularly timely with some of the concerns that have come up related to increased patient transport to EDs throughout the state. This collaborative patient offload plan, I know, is not new to this council. I want to say it's been presented once or twice. So our intent is not to go through this in detail, but rather to thank the folks that have participated in these collaborative meetings so far, and to remind the group that the development of this type of a collaborative plan really provides us with an opportunity to continue to streamline that offload as we may see increases in EMS transport moving forward with the busy months ahead. Dr. Bradley, is there anything in particular that you would like to note related to this plan and some of our most recent discussions?
No, I think a big thank you to Southern Arizona who initially piloted this, and then the Central region being willing to adopt this as well. As we potentially go into a busy flu season, we recognize we need to have other options out there for our patient population. Our patient volumes and acuity are increasing significantly, both in the pre-hospital and emergency department setting. This is not just a trend in Arizona, this is really a national trend that we are seeing. And so this is certainly one of many tools that can be used to address those patient populations. A reminder that came out of the kind of statewide collaborative was a request that we not alter this, but certainly take feedback if the group feels like there's certain things that need to be adjusted from a patient safety perspective. That stakeholder work group is really open to taking that feedback, but their request is that we don't alter this for the first few months so that we have a consistent playbook that everyone is using. So if your hospital or agency finds that there's areas on this that are problematic, please let Rachel or I know, and we will definitely track that and bring that back to the stakeholder work group. But they did ask that this stay as is without changes, at least for the first few months. Any questions about this?
Yeah, just real quick, Gail, it's Shari. The only thing I would say is there's a bunch of abbreviations in there that a lot of the hospitals may not know. Like, I have no idea what SBD is. I know what long board is, but I don't know what SBD is. Like, so I don't even know what some of it is when they start doing abbreviations on a document that's being sent to multiple places. Just to throw that in. Not to change anything, but.
That is a great point, and that's an easy non-context changing update, so we can definitely do that. Thank you, Shari.
Not a problem.
And Dr. Bradley, can you remind me, this, although the format may be slightly different, the criteria that we see in this plan in the Central region who has adopted this plan is the same as the Southern region currently?
Correct. I think the big difference was just the Southern region had kind of a stoplight red, yellow, green format. The Central region was concerned that that might be confusing if they have trauma activation criteria, so they wanted just more of a grayscale document. But the actual criteria in each category should be the same.
So we've seen wide-scale adoption with both the Southern region and Central region committing to using this as a tool moving forward with the busy months ahead. We applaud the regions for continuing to meet to discuss how this is going in the months ahead as well. And we look forward to being supportive, especially with the EMS Hospital Collaborative Forum that have come together. There will be another statewide forum planned in October to be able to collect some more feedback and just to make sure that patient throughput overall, looking at the system as a whole, we want to make sure that patient throughput remains as efficient as possible in these months ahead. So we will be using those forums as check-ins to monitor and see how we are doing. Now, should I just transition into the next agenda item?
Sure, yes, we can. So if we can get a motion to discuss, amend, and approve formation of a communications work group. If we get some motions, we can give a little bit of background on that.
Rebecca makes a motion.
Thank you, Rebecca. Is there a second?
Second, Brian.
Thank you, Brian.
Go for it.
All right.
Okay. So a related agenda item, thank you for that motion. As we've come together in these collaborative forums, the feedback that we have gotten on the offload plan is, it's great. We just need some help making sure that that information gets out there consistently to all of our hospitals and all of our stakeholders that are working so closely together. Something that has come up is that it would be helpful to have a work group, a communications work group, really come together to make sure that we are getting this information out communicated consistently and to ensure that there are safeguards in place moving forward with those busy months ahead. And so we wanted to bring that to this council as feedback that we've gotten from these regions, these regional meetings. And I guess the question is there interest in forming a communications work group around that? What does that look like? And who is it comprised of?
And I can also provide some additional information. We definitely realize that the Bureau has quite a bit of communication with our regional councils, but what the feedback we got from both hospital systems as well as from EMS agencies is that they may not necessarily be in contact with the regional councils to get that communication. So as we have plans like this that go out across the state, are there different avenues that we need to make sure this is communicated? So recognizing that lots of different groups meet, some of them have overlapping goals, but we want to make sure we get this out to everyone. These type of processes are really important. So I think the most efficient way, if the group is interested, would be forming a work group. That could certainly be just a one-time meeting if that's all that's needed, just to see what are some avenues that we could use to communicate messaging across the state. Or the group could vote not to do it either. That's also an option at the table. Any questions or comments or discussion?
This is Rebecca. I'll volunteer to be a part of that work group. I'd just like to see where it goes and what we can do, because I think this is really important and the right hand doesn't always know what the left hand's doing. So I see real positives that could come out of this. Thank you.
Thank you, Rebecca. Anyone else with feedback or wanting to move this forward or participate? So we do have a motion on the table to form a work group. Certainly we would need participation in the work group, otherwise it will be a rather small one. Rebecca will be doing lots of talking to one another. Is there anyone else that is interested? These are also open to non-council members too, so we can certainly get people who are not part of the EMS council that participate, but we would want there to be council members if this is coming from EMS council. So if the council does not want to form this work group, we could certainly not approve this motion. All right, hearing silence about participation or movement one way or the other, I will go ahead and just take a vote. So if you are opposed to forming this, which I'm thinking may be on the table since I'm not hearing much, say nay. So anyone opposed to formation of a communications work group, please say nay or type that in the chat.
A double negative. If you're opposed, say nay.
All right, I hear none. Any abstentions? All those in favor of forming a communications work group, please say aye or type it in the chat.
Aye.
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 Aye. Aye.
All right, I hear lots of ayes. I need some other volunteers besides Rebecca, otherwise we will volunteer some people to participate. We do need council members to participate if this is an EMS council work group though. So I tell you what, why don't you contact Shelley or myself offline? We will need to get at least a decent number to move this forward, but in the interest of time, we will go ahead and move along the agenda. Jim Hayden, are you still on the line to touch base about EMS resiliency update?
I am. Can you hear me okay?
Yes, go ahead. Thank you.
Super. Just one quick update for EMS Help. We made the announcement and the acceptance of the position of Chief Rob Brewster to be president of the foundation. So Chief Brewster, who's one of the assistant chiefs for the Peoria Fire Department, will be assuming the role as president of our foundation. And also, if you haven't had the opportunity to visit stopourstigma.org, stopourstigma.org. I would encourage you to do that and sign up. I think I've already signed up for the pledge. Things are working very well, and I'm looking forward to the continued success of eradicating suicide in our industry. And that's all. Thank you so much.
All right, thank you very much, Jim. All right, next up, discuss upcoming regional EMS needs assessment and request for specific workforce training and priorities.
Do we need a motion, or we can make that?
This is just a discussion item.
Okay, in the interest of time, we wanted to share with the council that this year's regional council contracts do include participation in an EMS needs assessment survey. So we will be pushing out, much like last year, a needs assessment survey to get feedback on training and education needs and any other specific workforce needs and priorities from a regional perspective. I'm not sure that we really have time to discuss this in detail, so we'll put it on your radar that we will be working with the regional councils on these needs assessment surveys in the very near future. We will be making sure that we follow up and provide summary level information to the EMS council. And if there are any EMS council members that feel very passionate about this and would like to reach out and share anything that should be included in this survey, please let us know, but we will be following up with the regions after this.
All right, thank you.
There's a comment from Dr. Casterman requesting that be made available participant roster of the EMS Hospital Collaborative Forum.
Next up, any agenda items to be considered for the next meeting? Call to the public. Summary of current events is on the agenda, and we also have a couple links to the Bureau's website with a list of news and conferences along with training options. Our next meeting will be January 19th, 2023 at 10:30 a.m. Location to be determined. Again, we do have more people in person today, which is wonderful, so hopefully we can see more people in person in January. And if I can get a motion to adjourn the meeting, please.
So moved,
Motion to
Roy.
adjourn. I'll second Roy's motion.
Excellent. All right, meeting adjourned. Thank you, everyone.
Thank you.